Muy bien, muy buenas noches. Son las 19 horas con 2 minutos de este martes 26 de mayo de 2020. Estamos en el Palacio Nacional de México, en la Ciudad de México, y vamos a iniciar la conferencia de prensa diaria sobre la situación de coronavirus, el nuevo coronavirus, la epidemia de COVID causada por el nuevo coronavirus SARS-CoV-2. Hoy nos vamos a tener varios temas, vamos a tener el informe técnico, vamos a tener el martes de movilidad y el doctor Ricardo Cortés, director de promoción de la salud, hablará de la movilidad en el espacio público. Y también tenemos el gusto, como siempre, de que nos acompañe nuestro querido amigo y compañero, el maestro Zoe Robledo, director general del Instituto Mexicano del Seguro Social, para hablar de un tema que nos parece extraordinariamente importante también, y es las trabajadoras del hogar, las personas trabajadoras del hogar. Y nos acompaña Marcelina Bautista también, quien es la coordinadora del Centro de Capacitación para Trabajadoras del Hogar. Ya nos explicarán ella y el maestro Zoe sobre cómo el IMSS ha hecho una transformación muy importante.
And we're going to hear about how IMSS has initiated an important transformation about health and social security for domestic workers. So if Dr. Jose Alomia can please present the technical report.
Muy buenas tardes a todas y todos. Vamos a hacer el informe.
Good evening, everyone. We're going to do the executive report in order to give, or a shorter report in order to give time for everyone else. We're on the 65th day of the National Safe Distancing Campaign. Let's look at an update of the international picture. The proportions are about the same for the active epidemic. We can see how the percentage in the Americas has increased somewhat. It's always been above 50%, and right now it's at 54%. However, in Europe, they are continuing to decline in the number of active confirmed cases. These are the figures as of today: 74,560 confirmed cases of COVID-19 out of a total of 235,129 people who were studied and tested. We already have 128,691 people who tested negative. And in terms of the active epidemic, in Mexico represents about a fifth of the confirmed cases, 14,718 cases, and unfortunately, 8,134 people have died due to COVID-19. This slide shows the distribution of the cumulative load. There hasn't been much change within the last week. However, today, about a fifth state has been added to the highest ranks, which are states with over 3,000 cases. This slide shows, again, the same data state by state, and now Tabasco and Veracruz have gone over this 3,000 case mark. And that's since the beginning of the epidemic in Mexico. This shows just the active epidemic, the 14,718 confirmed active cases. And here, the distribution is based on the color gradient, and it's very similar to what we've seen in the last few days. This next slide shows the distribution in descending order. And about 80% of the states are below 500 cases. So that's people who have had an onset of symptoms in the last 14 days. This is the distribution by cumulative incidence rate. It's currently 11.5 nationally, but that could go up to above 20 per 100,000, depending on the pending cases. So the concentration of the incidence rate is increasing, and that's where we see the highest levels of transmission where we have the highest population levels.
Esta misma distribución en orden
This
descendente.
slide shows the
Ciudad de
same
México,
distribution, but in
Tabasco, Yucatán y
descending
Baja
order.
California son las que concentran
Mexico City,
la mayor
Tabasco,
tasa de
Yucatan, and
incidencia
Baja
en los últimos
California are the
14
states
días.
that have the
Veamos la
highest
siguiente
incidence
diapositiva, que es
rates in the last
precisamente la
14 days.
distribución de personas que han
The
perdido la
next
vida a
slide
causa de
shows the distribution
COVID-19
of
por la
people
fecha
who have died
de
due to
ocurrencia,
COVID-19
estas
by
8.134
date of
defunciones.
occurrence.
Podemos ver que hay
So this
716
8,134
defunciones que tienen
deaths,
una
we
muestra
can see
pendiente
out
de
of those,
resultado y que también se
there are
distribuyen de esta
716 deaths
manera.
that are still waiting for
En la
test
siguiente
results
diapositiva
and are not
veremos
confirmed to
esta
be
misma
caused by
carga de funciones, pero ahora
COVID-19.
distribuida por
This
entidad
shows the
federativa de
same
ocurrencia
burden
y en el
by
color
state
naranja ámbar
where the
la
deaths occurred.
expectativa de que estas defunciones todavía puedan
The light
incrementarse en función de cómo se
colored
vayan
bar
dando los
shows the
resultados de
deaths that
laboratorio
are
y por lo
still to
tanto
be confirmed, and
confirmándose
so
a la
this
enfermedad.
could
En la siguiente
increase
diapositiva,
the
nuestra curva
numbers caused
epidémica
by the disease.
actualizada. Vemos la
This slide
tendencia que
is the
continúa
updated epi curve.
completamente ascendente.
As we
La
can
mayoría de los
see,
casos
the
todavía
trend
son
is
sospechosos por
continuing
falta de
upward.
un resultado
The
de
majority
resultado
of
de laboratorio,
suspected
sino
cases
prácticamente en los últimos,
that are still
en los
awaiting test
últimos días, en
results
función de cómo se van acumulando en la
have
medida de cómo van
occurred
avanzando
in the
atención
last
médica y
14
cómo van
days, and we'll see
ingresando
how
en
that
los
will
protocolos de
accumulate
screening.
with the total
En la
numbers
siguiente
based
diapositiva,
on the
la
number of
carga
people who are
acumulada, los
being tested.
74.560,
This is the
fue un incremento
cumulative
de
load,
4.9%
the
al día de ayer, pero que representó
3,455. It's a 4.9% increase over
3.455.
yesterday.
Podemos ver cómo se
So there
incrementó
were
la barra de color
3,455
naranja en la
new
parte
confirmed
inferior en
cases.
relación a los 2 días
And so in the
previos,
lower
que
part, you see the
representaban, ya
orange bars
decíamos, un
has
poco
also
más de
gone up a
actividad de
little bit
fin
in the
de
last
semana y que
couple
ahora
of days
empezamos a ver ya una actividad
because those are people who may have
más
presented with
apegada a lo que
symptoms
está
over the
sucediendo
weekend.
en las entidades federativas.
And so that's a little bit
Veamos ahora
closer
la
to what's
ocupación y
happening in all the
disponibilidad
states.
hospitalaria.
Now we look at the
96%, la
occupancy
notificación
and available capacity at the hospitals.
730
95% reporting
de
capacity is what
759
we're
hospitales
seeing
que realizaron su
out of the
notificación en la red
759
IRAG.
reporting hospitals
9.399 fueron
through
las camas
our
IRAG general
COVID hospital reporting
ocupadas,
network.
por lo tanto es una ocupación del 38%, la cual si recordamos números
So we have a
previos se ha mantenido
38%
prácticamente estable
occupancy
durante
rate right
los
now, so
últimos 5 días. En la siguiente
9,399 beds
diapositiva podemos ver
occupied.
la distribución ahora sí de
And the
esta
next slide shows the
disponibilidad.
distribution
Guerrero encabeza
showing the
la
availability and the
ocupación, en este
occupancy.
caso con la menor disponibilidad. Se está
Occupancy
trabajando ya
right
de manera
now
conjunta
have
con
the
el
lowest
Estado
levels of available
para poder
capacity,
tener siempre camas
and we're working together with
disponibles.
the
Ciudad
states
de
in
México,
order
Estado
to
de
ensure that
México,
there
Baja
are always
California
available beds.
Hidalgo
Mexico
en su momento
City,
eran estados que
Mexico
ya
State, Baja
venían teniendo
California,
esta
and
actividad,
Hidalgo
aunque se ha
are
podido
states that
nivelar en
at
función de que
certain
aún
points
queda
had a
una
certain
buena
level of
proporción de
activity,
disponibilidad. Si
but
vemos
they still
ahora
have
en
a
la
pretty
siguiente
good
diapositiva las camas
proportion of
especialmente
availability.
orientadas a la atención
These
de pacientes
are
críticos,
the numbers
34%
for
es la
beds
ocupación
that
media a nivel
specifically have ventilators
nacional,
for
pero
acute
también
patients.
México, Baja California, Guerrero, Ciudad de México,
We
mismo
can see
Chiapas en
again
su
that
momento están
Mexico State,
teniendo
Baja
la mayor
California,
ocupación,
Guerrero, and Mexico
aunque
City
todavía cuentan
all
con
have the highest
disponibilidad
occupancy levels,
de
although they
camas en
still
función de
have
los porcentajes que están en la parte
available beds
superior.
based on
Estamos
the
agregando una diapositiva
percentages that
más
you
el
see in
día
the upper
de
part
hoy,
of
que
the
es la
bar.
siguiente, para ver un poco cómo ha sido precisamente la
So
evolución de
as
los
of today,
hospitales
we're
que en
going
su
to look
momento han
specifically about the
notificado a la red
changes
IRAG.
in
Vemos cómo
hospitals
empezamos
who
allá
have
por
been
el 24
reporting
de
to
abril
the
con
network.
alrededor de 650 hospitales
As of
notificantes
24th of
y por
April, we
ejemplo
have
para el corte
about
de ayer ya se llegó a
a number of
759.
hospitals who
Esto
are
también tiene que
reporting,
ver
and
con
we
el
now have
incremento en la designación
759
de este tipo
hospitals
de
that are
unidades que
reporting.
hacen
So
las
we
entidades
have an
federativas en
increase
donde
of
van
these types of units
definiendo cuáles son
in
sus
all of the
hospitales
states,
COVID y los van además
and
dotando
it's the
de
states who determine
equipamiento de
which are their
personal y
COVID
de insumos
hospitals
para que puedan
and which are
estar
equipped
siempre
with the
atendiendo
both staff and
los casos.
equipment
Entonces aquí vemos
to
cómo esto
take
también
care
para
of
efectos de la
COVID-19
reconversión de la
cases.
expansión es parte de
So
la
this is due to
preparación y de
retrofitting
la
and expansion
respuesta
of
que a nivel
hospitals,
hospitalario se ha tenido en
preparation,
México
and a
desde que se inició
response that we see
y que ha
across
ido
the hospitals
incrementándose
in
en función
Mexico since the
precisamente de
epidemic
las
started.
necesidades
And this
de
capacity
demanda de
has
atención
increased based on
hospitalaria.
needs
Sería la
and
actualización para el
demand
día de hoy.
for hospital
Muchas
care.
gracias, doctora
So that's the
Lomía.
technical
Me pide
report for
seguir al
today.
doctor Ricardo
Thank you,
Cortés, que
Dr.
nos comparte el
Alomia.
informe de movilidad.
Now we're going to hear from Dr.
Con mucho gusto,
Cortés,
doctor.
who's going to
Muchísimas
talk about
gracias.
our
Muy buenas
mobility
tardes a
reports.
todas y todos.
Thank
Buenas
you.
tardes a todos
Good evening,
en casa.
everyone.
Vamos a analizar,
And good
como
evening to
cada
everyone at
martes,
home.
la movilidad en los estados
Like
con
every Tuesday, we're going to look at the mobility across all the
el
states.
mismo fin de ver
And the purpose, as always, is to see which states have been able to achieve a mini goal of reducing their mobility in public spaces. And so we're using 3 different information sources: Google, Twitter, and Facebook. The blue line that you see, the blue bar, is as of 23rd of March, which is the start of the Safe Distance campaign. As you can see on the first 4 graphs, Baja California Sur has been able to maintain levels below the goal, Aguascalientes, even though that Google is showing that they've been able to stay around the goal. It seems that Twitter users have increased their mobility levels, and so we ask people in Aguascalientes to keep staying at home. So this is what the health authorities, both federally and at the state, are asking people to do. Baja California is a little bit above 65%, but as you can see in the last graph, the state of Campeche, Twitter users are below that 65% goal, and other users are staying steady around 50%. For the next 4 states, Coahuila, Chiapas have mobility levels that are close to 65%, but people can make a greater effort even to reduce mobility further. Something that is of note is that Facebook users in Colima on certain days have even exceeded and gone over the 0 bar. So that means that they are going out excessively. Mexico City is really close to that 50% mark. Durango is above in the last few days. Guanajuato is declining somewhat, and its Twitter users have decreased mobility. But on Google's Android system, those users are over that and are around 50%. And in Guerrero, almost all of our systems are showing that those people are getting close to that 65% mark. Hidalgo, Jalisco, Mexico State, and Michoacán. In Hidalgo, in Google's Android system, are really close to the 65% goal. You can see in the last few weeks how Twitter users have reduced their levels, and mobility in Hidalgo, as well as Facebook users, have more erratic mobility levels. Jalisco is closer to that 65% goal, but we've seen an increase in Facebook users. Mexico State is still quite above that 65% goal. And Michoacán in the last couple of days has been declining in its mobility levels, but it's a state that still has a fair bit of mobility based on the most recent data that we've gotten from Facebook and Twitter. Next one, please. Morelos, Nayarit, Nuevo León, and Oaxaca. On this slide, for example, in Nayarit, it's one of the states that has exceeded the 65% goal, specifically Twitter users, not so much to the Google and Facebook users. In Nuevo León, it has a pretty standard behavior in the last little bit, close to 65%, but they still have a bit to go. And in Oaxaca, in the last few days, we've seen a decline in their mobility. Here, Puebla, Querétaro, Quintana Roo, and San Luis Potosí, we can see that Querétaro has stayed below even 85%, but not Puebla, Querétaro, and San Luis Potosí. So the population of those states can still make greater efforts. In San Luis Potosí, there was a little bit of an uptick in among Twitter users in the last couple of days, with respect to mobility.
Tabasco y Tamaulipas, con
Sinaloa, Sonora, Tabasco, and
un
Tamaulipas.
incremento en la movilidad de los
In
usuarios de
Sinaloa,
Facebook.
we've
La
seen
verdad es
an
que se ha
increase
mantenido
among Facebook users in
muy
mobility.
pegado al 65%, pero en últimos días con mucho
They've been very
movimiento
close
los
to
usuarios de Facebook.
65%,
En
but
Sonora,
a lot more movement
los
among
usuarios
Facebook
de
users in the
Twitter
last few days. In
y Google se han
Sonora,
querido mantener
both Twitter
dentro del
and Google
65%,
users
pero los de
have been
Facebook
able
parece ser
to
que
stay
no.
around
En el
that
estado de Tabasco también
65%, but
pegado al
Facebook users not
65%
so
y
much. In
Tamaulipas
Tabasco, they're
alrededor del
sticking around that
50%, todavía
65%, and
pudieran estar
Tamaulipas
haciendo
is
un
around
esfuerzo mayor para
50%,
llegar
so
al
they could still
65%
be
de descenso.
doing
La siguiente,
better
por favor.
to get to the goal of 65%.
Tlaxcala, Veracruz,
Next
Yucatán
one, please.
y Zacatecas.
In
En
Tlaxcala,
Tlaxcala
Veracruz,
vemos también
Yucatan,
los
and
usuarios de Twitter
Zacatecas.
con,
In
llegando a la
Tlaxcala,
meta del
we see that
65%, no
Twitter
así los de
users
Google
are hitting
y
that goal
Facebook.
of
Veracruz
65%, but
también
not
por
the
encima
Google and
de la
Facebook
meta.
users.
Creo que se
Also,
puede hacer
Veracruz
algo
is
más
above the
llegar a
goal,
este 65%. En Yucatán han hecho un
but they can do more
esfuerzo
to
bastante
hit that
importante
goal.
también, al igual que
In
en otros
Yucatan, they've made a
estados.
pretty
Están por debajo
significant
de la
effort,
meta del
as well as in
65%.
other states that
Zacatecas,
are below the
que pueden ver
65% mark. And in
ahí los usuarios
Zacatecas,
de Twitter cómo hicieron un descenso
you'll
bastante
notice
importante
that Twitter
después de
users had a
que el
significant
gobierno del estado de
downturn
Zacatecas hiciera
in
un llamado para
their
atender a las indicaciones
mobility
de la
levels
Jornada
because the
Nacional de Sana
Zacatecas
Distancia.
government
La siguiente, por
made
favor.
an appeal for people to
Este
respect the
gráfico,
safe distancing campaign.
lo que estamos viendo es la comparativa de
What we're
las
seeing
últimas
in
2
this
semanas, la
graph is
movilidad
a
de las últimas 2
comparison
semanas
of the
comparado con
last
la
2
última
weeks,
semana, qué
so it's
estados
mobility levels in the
incrementaron
last 2 weeks
su
compared with the week
movilidad, qué
before,
estados disminuyeron
and which states have
todavía más
increased their
su movilidad.
mobility and those
Por
that
ejemplo,
have
Querétaro,
further
Morelos, Puebla,
decreased
Tlaxcala,
mobility
Nayarit
levels.
e Hidalgo disminuyeron
Querétaro,
todavía un punto porcentual
Guerrero
más su
and
movilidad, y
Coahuila
en rojito
decreased
están
some of their
todos
mobility
estos
a little bit more,
estados
but the ones
cuya
that in
movilidad
red
se
are all of
incrementó
those
en un más de
states
3%
whose
de
mobility
una
levels
semana a
increased
la
by
otra.
more than
La siguiente, por
3%
favor.
from 1 week to the next.
Y no, la anterior. Entonces, con esa basta. Muchas gracias.
Nope, not that one.
Gracias.
Okay, so
Muchas
that's
gracias,
it
doctor
then.
Ricardo Cortés, director
Thank you,
general
Dr.
de
Ricardo
Promoción de
Cortés.
la Salud. Vamos a entonces entrar en la
He's the
parte
Director
de
General of
temática
Health
especial.
Promotion.
Quisiera presentar a
Now on
Marcelina
to our special
Bautista,
topics,
quien hoy
I would
nos
like to
acompaña
present
junto con el maestro Robledo,
Marcelina Bautista,
y
who is
dejarles
together
enseguida la
with
voz
Mr.
a ellos
Robledo,
para que comenten.
and I'm going to pass the
Marcelina
floor to
Bautista
them in a moment.
es originaria de Tierra Colorada,
Marcelina Bautista
Apasco, Nochistlán,
is originally
Oaxaca.
from Tierra
Al terminar la
Colorada,
primaria, ella se vio obligada a dejar a
Oaxaca,
su familia y el sueño de seguir sus
and
estudios
after
para
finishing
venir a la
primary
Ciudad de
school, she
México
had
a
to
trabajar
stop her
como
studies to
trabajadora
come
del
to
hogar
Mexico
cuando
City
tenía
and
14
work
años.
as a domestic
Tiene una
worker
experiencia de trabajo de
when she was only
22 años
14
como
years
trabajadora
old.
del hogar y como
She has
asegura ella
22 years
misma,
of experience as a
caminamos
domestic
para que
worker,
nuestros
and as
derechos
she
sean los
herself will
mismos que
say,
tienen las demás
we
trabajadoras.
move
Sin
forward so that
esperar
we can have the
que un
same rights as
momento
all other
para
workers.
comenzar a mejorar el mundo, como ella misma lo declara, ella ha
Without
realizado
waiting to
distintas
start
campañas
making the
para dar
world a better
visibilidad
place,
a
she has carried out
2.4
a number
millones de
of
trabajadoras del
campaigns
hogar en
to
México
make
y mostrar los
2.4
problemas que
million domestic
enfrentan.
workers more
Por lo
visible
tanto, y en
in Mexico
consecuencia,
and the
Marcelina
challenges
es
they
fundadora
face.
del Centro de Apoyo y Capacitación para Empleados de Hogar,
Marcelina has founded
que
a
se
training
denomina
center
por
for
sus
domestic
siglas
workers,
CACEH, C-A-C-E-H,
which
en el año 2000.
by its
Desde ahí ha
acronym is known as
promovido los
CASIC, and
derechos
that was in
humanos y laborales de las
2000.
trabajadoras del hogar
She has
y llevó
promoted
a cabo
human
un
rights and the
proceso de
rights of domestic
sindicalización del
workers through
sector
that
laboral. Y así
organization
surgió el
and
Sindicato
has worked for
Nacional
the
de Trabajadoras y Trabajadoras
unionization
del
of the
Hogar,
sector.
que se formó
So
el
on
30 de
behalf of
agosto de
domestic workers,
2015.
she is
Como el primer
working very
sindicato nacional
hard
de personas
and
trabajadoras del
established an
hogar en México.
association in
Marcelina Bautista fue secretaria general
2015.
colegiada durante 3 años
Marcelina
del
Bautista was
primer
the
periodo del
Secretary
sindicato
General
y
for
actualmente es la directora
3
de
years
CACEC
of the first
y
union,
trabaja para el
and she is
fortalecimiento
now
del
the director
sindicato.
of CASIC and
Ocupó
works
diversos
to
cargos en la
strengthen
Confederación
the
Latinoamericana y del
union.
Caribe de Trabajadoras del Hogar y llegó a ser secretaria
She
general.
worked or
Máximo
held a
cargo que
position
se
in the
pudiera
Latin
ostentar
American and
dentro de esta
Caribbean
organización
Association for
en el
Domestic
periodo
Workers, and it's one of
2006-2012.
the highest
Finalmente,
positions
ella fue
held within this
coordinadora regional de la
organization
Red
in
Internacional de Trabajadoras del Hogar
2012. She also
2009-2013,
coordinated a
después
network of
coordinadora
domestic
regional
workers in
para América Latina
2013, and then
y
the regional
de la Federación
coordinator for
Internacional de
Latin
Trabajadoras del
America
Hogar de
of the
2013 a
International
2016.
Federation of
Tiene una
Domestic
extensa
Workers
participación en
from
distintos foros
2013 to
donde se ha
2016. She has participated
expresado
in a number of
estas posturas y la
forums
necesidad de
that
garantizar
put
recursos
forward these
promover
proposals and work to guarantee, recognize, and promote the rights of all domestic workers through an organized forum and complying with the commitments that all member states of this organization have signed, including Mexico, and as well as the Convention 189 for domestic workers, and that's of the International Labor Organization that was signed in June of 2011 in Geneva, Switzerland. It's a pleasure to have you here for building social equality of domestic workers. Marcelina, thank you so much for being with us today, and I'm going to pass the floor to you so that you can tell us about what we need to know today. Thank you for giving us this very important forum in which to present our information. So the situation of domestic workers is one of the situations that has suffered the most because of this pandemic. Later on, when the doctor speaks, we're going to talk about a video that we're going to show. But today, specifically, the movement to defend the rights of domestic workers is initiating a campaign called Take Care of Those Who Take Care of You. We have participation of civil organizations, artists, and culture workers. We also are thankful for the support of the Mexican government that has given us this forum in which to announce the campaign that we've started. 96% of domestic workers do not have Social Security, 98% do not have a contract, and very, very few have other rights. And today, they have been enormously affected by the crisis. We have been working since March very hard for our colleagues who have lost their jobs or have seen their hours reduced or who have been unfairly dismissed from their jobs in this quarantine where they have no rights, and specifically their wages. So that's why CASEC is launching this campaign as an appeal to employers. We ask that you not fire your domestic workers, that you pay them, and recognize the hard work that these domestic workers have done with your families, in your homes, and support them when they need it. Today, many domestic workers are taking care of elderly people who are sick or children who are at home, and they are always at risk because their job requires physical closeness with the people that they are taking care of. So therefore, it's very important to ask that employers provide all the care that these workers need to continue working. So taking care of who takes care of you is to raise awareness of employers of the rights of domestic workers within the context of the crisis that we are currently experiencing. So please go to www.covid19.org.mx, where we have support from Alfonso Cuaron and participation of the government. We created a video that raises awareness and also shows what can be done, what domestic workers can do. So it's not an issue of charity, it's not asking a favor, it's the rights that these workers deserve. And we ask employers to join us in solidarity by continuing to pay them because they are entitled to also have a salary during the quarantine. See this video and help us spread it throughout Mexico. So it's not only domestic workers who are losing rights today. There are many other groups of workers who have been very important to our society, who have worked very hard to get ahead with their jobs, either as sellers making shoes, or any job. So these workers now today need the supports that we can offer them. So we developed a hashtag, Cuida quien te cuida, and we ask all the employers to do the right thing. Respect the rights of your domestic workers. Those rights today are enshrined in the law. Those rights are found in Chapter 13 of the law, so there's no reason to not give them a day off or a sick day or their vacation. So I ask from my position here to ensure that these domestic workers have the right to take a day off, whether it be on the weekend or other days. Some of our workers have been shut in for 2 or 3 months. And of course, they're going through a lot of stress. And so we ask that you pay attention and take care of those colleagues.
Marcelina, si me permiten,
Thank you, Marcelina. So I'm going to show a presentation with a few additional figures and information. Dr. Lopez-Gautel and the whole team have insisted on a piece that's really the spine of the strategy of staying at home. So what does it mean to be able to go in someone else's house? What happens to those people who live in those homes? And as Marcelina mentioned, sometimes they've been dismissed. So they've been affected dramatically. One that is we should not be seeing in a country such as Mexico. We've seen examples and actions of responsibility. As she said, it's not an act of charity, but responsibility and solidarity. But in other cases, not. As Marcelina already said, there are 2.4 million identified domestic workers, and the majority of them do not have contracts, have very long working periods without any defined time. Every day at 6 o'clock in the morning, we see for the group that's in the pilot project, as we'll see on the next slide, it's a measure that could be used for seeing how it's affecting domestic workers. In the best of cases, maybe it's only affecting 1% of domestic workers who live and work in Mexico. But today, as it's Mobility Tuesday, at this press briefing, this is a diagram of where these domestic workers were born and where they are working. 19.6% of domestic workers were born in the southern region of the country, and the red line indicates the flow of mobility within the country. So the majority are working in the center of the country. 53.79% work in the center, and we have others in the north, and just over 53% work in the center of the country. So this is internal migration. So we also know that a large part of the wages of these domestic workers is used to send money back home, where they were born, the houses that they left many years ago. So it's like a remittance. So that's why these solidarity circles is not just about paying what these domestic workers are entitled to, but it also trickles down into other actions.
This is a pilot project that we've been working on for 1 year, but we had to work along with legal reforms, and finally in April of last year, along with the Secretary of Labor, we got this project moving. And this meant that 22,300 domestic workers would be supported by social service. This is social service for maternity leave and for health protection. Today, these people have insurance for maternity leave and illness. So they'll be able to get medical attention. They'll be able to solicit credit. They will also receive insurance for old age, an old age pension. They will also receive insurance for childcare. But the majority of domestic workers don't have this. This is why since December 2019, since we received that monumental law change, we have seen a difference in the support that we're giving to these people. We've also had participation from Participant Media and Alfonso Cuaron. And what they wanted to do was make a special type of marketing material here. This was put into action after the movie Roma. And there is an excellent expression there saying, we're going to put as much elbow grease into it as we need to. And in Spanish, it's fregamos y fregamos. But things have still been progressive slowly here because it seems that people still don't understand it's not charity. It's about health and responsibility. Just like Marcelina said, many domestic workers end up taking care of older people or children, being nannies. In many cases, while they're doing their domestic work, which has very long hours, they end up also cooking besides doing the cleaning. So there are so many things that have come into play. And when we think about the new normal, we have to think about taking responsibility. Each of us, each and every person who has a domestic worker, either full-time or part-time, they need to be registered. They need to be registered with the Mexican Social Security Institute so they can access the rights that they have a right to enjoy. There are other mechanisms that can also work so that we talk about supporting people with a salary. And we're very grateful with Marcelina, with Case, with other participants like the Hijos de la Malinche, but above all with Alfonso Cuaron for supporting this new initiative. Please get on board, tell people about this. Part of our new responsibility under the new normal is a responsibility toward everyone. Let's get aware. We need to help people that are always there for us. And one of the best ways of being Mexican is to do this. So I would like to show you the video now. Maria, we have to cancel. You can't come to clean our house. We can't risk our children getting sick or someone being infected. Please be careful. Thank you. You too. Send my love to the children. Maria, we're locked up at home all month and we don't have anyone to clean for us. Hello, is there any way that you could help me with a loan? Maria, we all have to stay at home and take care of ourselves. You too. This month, we don't need you to come and do the cleaning. Hello, ma'am. I hope that you're well. I really thank you so much for worrying about me. Could we come to an agreement? You know, I live hand to mouth and this situation has become very complicated. Maria, of course, we were already going to offer to pay your salary until you could come back with us. Thank you, Senora. You don't know what this means for me and my family. Your work in our home is very important. We all have to help each other. We're all in this together. The majority of domestic workers live day to day. The majority of domestic workers don't have Social Security. Do the right thing. Take care of those who take care of you. Visit covid.caceh.org.mx. Thank you. Thank you very much, Soy Robledo. Thank you so much, Marcelina Bautista, for bringing us this message. I'd like to pick one thing up. Why have we been saying this every day or every single day that people have concerns about staying at home? we have insisted that we need to be aware that there are two elements that we need to find a balance between. We need to strike an equilibrium. We need to control contagion. This is priority. We cannot put this off because we want to protect people's lives and health. But on the other hand, in Mexico and anywhere else in the world, the measures of health crises for safe distancing and to control contagions in an epidemic means that we have to demobilize people. And this means that people who live day to day, they're having an extremely hard time with this. And Mexico has polar opposites in terms of social stratum. And this is exacerbated this problem that over the last 40 years has been very serious. People are suffering socially, economically, under the law, politically, in every single way. So I think it's extremely important to understand this message from Marcelina Bautista today. And we all need to really digest this information and be aware that everyone has to have access to the rights that they deserve and that they are entitled to under the law. It's not about goodwill. It's not about being nice. It's an obligation. It's an ethical responsibility, a legal responsibility. And we need this for social justice, and we are going to do this. And it's all of our responsibilities. Even if we don't have a written contract with our domestic workers, we must fulfill our responsibility. Thank you, Marcelina. Thank you, my dear Zoe. Liz, you, Carlos, let's go. Okay, you. Okay. Good evening, everyone. Liz Alvarez from Grupo Canton. My first question is for Zoe Robledo. Do you know up to now how many domestic workers have been infected by COVID? And if they have security, social security, or they're covered under the Mexican health system, do they, even if they don't have coverage, can they get attended? And in terms of Miss Marcelina, in terms of the domestic workers who have lost their jobs, will they be receiving a salary from some other place? And I myself know cases of people who have asked to get this insurance and they haven't been able to get it. Do you have a message for these people who are watching? What do you have to say to them? Thank you. Go ahead. Oh, yes, with great pleasure. In terms of the total number of domestic workers who are in the pilot program, we don't have a very big number. Unfortunately, we have more than 2 million people in our country who are not insured. This doesn't mean that they haven't gotten medical attention at some public hospital or at a social security hospital. We are still receiving people who are not members of the public health system, who are not entitled to coverage. We're still covering them. Now, with the work that domestic workers carry out, it's so important, and we wish it was regularized. But this is a really good work about question about domestic workers in the pilot program. We don't exactly have the number of people who have been affected. I don't think it's that many. We're also going to have a 25,000 peso support, which is going to really help. And also we have this campaign that is going to create solidarity and that is important for the rest of our pilot program. Well, what I say every day to my colleagues, there's no way to say to you, be calm, stay at home. You can't say that to them. They don't have any money. They don't have any money to buy food. besides telling them stay at home, because that doesn't apply to so many of these people because they live literally hand to mouth. So what we do want to underscore with this video is that it make people a little bit more sensitive and do your part, do what is your responsibility. Employees, these same domestic workers, they know their rights. And they must demand what is rightfully theirs, not more, not less, but what the law says. So all of these domestic workers who would rather work instead of make demands to be paid, well, I'm sorry, but sometimes they say, well, I work more than 14 hours, and they ask for Social Security, and then their employers don't want to give it to them because they don't have money. And then they say, if we give you Social Security, we're going to lower your salary. But at the end of the day, they don't do anything. So for years, we've been working on this and we haven't been able to organize ourselves because they'd rather have a precarious employment and even be discriminated against than stand up for themselves. But we are going to get organized. And my colleagues have asked me, let's get together and let's demand our rights. Let's do it. Let's make this happen. Because these are people with rights. These are workers with rights. And all of our organizations from civil society, especially the Center for Training and Support, we give coaching and we also give training to domestic workers. And today we're suggesting, we're refocusing on how we can get back into work with the new normal, because all these domestic workers also have to have more measures in place to be protected. They're going to go back to work and they need to sign a contract and they need Social Security coverage. Thank you very much. Good. And then you. Good evening, Secretary. Good evening, Deputy Secretary Gattel. Good afternoon, Marcelina, Director. Angel Juan Sanchez from Arsenal.net. My question is about health. Are you considering some sort of public policy in order to deal with further pandemics? Thank you. In general terms, the preparation work for a pandemic, it doesn't start when we're preparing for when the pandemic is actually happening, which is kind of what happened with Mexico. But on January 3rd, we started to make preparations. We were in the whole world affected just as others were. And when China was affected, we started to make preparations. Over the years, and I want to recognize all the contributions from previous administrations have put into place in order to prepare and establish measures. And this is about epidemiological monitoring. We have a magnificent national reference laboratory, the INDRE. Many years ago, for many years, this has been part of all kinds of epidemiological monitoring since 1929, just like our other Ministry of Tropical Diseases. And so we have reference labs that have been in place for a long time. And our epidemiological monitoring means that we are able to respond in terms of public health. We have professional research epidemiological teams, and they can do outreach with health systems. Then we also have institutions that are helping out with medical attention. So it's this huge repertoire, including scientific research. That's fundamental. We're taking a look at some of that research today, and those mathematical communities of geographers and mathematicians. All of that is a process to prepare that goes on for a long time before it gets executed. A pandemic is an opportunity to review what we have learned in the process of always being prepared. Something that started much before COVID, when we started our administration, this current administration, And I think we've talked to a number of you about this. We're going to have 3 new national centers that will be stepping into gear. The Health Emergency Center, that's going to be a specialized center for coordinating, preparing, and being ready for emergency responses. This is not just because of COVID. This is a project that we began with our administration. Our National Diagnosis Health System, which INDRE will also be part of, and then we have the network of public health laboratories that will increase their capabilities, their capacities, so they will be able to do more diagnosis that is clinical diagnosis. All of this would work with the National Health Reporting Information System and the Epidemiological Surveillance System, which will be all together under one umbrella, and we will have this all concerned with health safety. Now, all of this preparing, this happened before COVID, but COVID makes our steps even more sure as they go forward. Thank you. Over here, you from Sonora. And Blanca Valadez, then Carlos. Okay, yes, and then you at the back. Hello, good afternoon, doctor. I'm, yes, from Sonora. I'm a business person and I also speak on the radio. My question is specifically about Sonora. We are worried in our state. We understand that there are many pandemics within the pandemics, and perhaps Sonora, because of its incidence rate, is not so important because we don't represent that many cases. We have 1,300 confirmed cases. But we've seen, for example, in the mobility report, that Sonora is not doing a good job on its mobility. They have more than 65% mobility. I'm worried about a contagion rate that is much higher than anywhere else within the politicians. We have the labor secretary who is infected with COVID. We have deputies that have coronavirus. So I'm a little worried about all the coronavirus in the political atmosphere and the political ambiance. So maybe if we have more information on Culiacan, Tijuana, Mexico City, would it be possible for you to report what the epicurves are in each of those states? I know it's hard because we have Hermosillo, because of all of its specific attributes, but we have our governor with many followers who are watching the press conference each night. And so I see that from the mobility report, our mobility is above 65%. So should we make an appeal to Sonorans to work harder to stay at home and flatten the curve up there? Thank you. Yes. In fact, I have recorded messages specifically for Sonora with messages that are similar that I have recorded for other states, exactly like you very correct say, and this applies to all of Mexico. If we don't reduce mobility and stay at home, we're not going to reduce contagion. Sonora, I can tell you, I have some informal information right before my eyes here. Our technical report that we get shared, that the mathematicians share with us, in the case of the city of Hermosillo, the crest of the epidemic curve would occur at the end of May. That would be around June 4th that they would be hitting their apex of the epicurve. So you still have a little bit more of the epidemic to go over there. It might spread until the first week of August. And what we've seen in our transmission indicators, specifically the number of cases that have cropped up over time, there is a higher transmission rate, and it's probably because there's so much mobility in public. Governor Claudia Pavlovich, who I talked to this morning along with other people in the convention. What's it called? The National Governors Convention, the CONAGO. we organized a meeting this morning and we talked with federal health authorities and others. And that's exactly what Madame Governor expressed and was emphatic about. She said, when you in Mexico City talk about how we're going to a new normal, people in Sonora think that we're going to be in the new normal. So I want to recognize Madame Governor. She takes this very seriously. And it does coincide exactly with what you, sir, are saying. So we want to appeal to the state of Sonora. We do this for the whole country, but we also want to talk to Sonora specifically. You still have quite the stretch in your epi curve. It's still very important for you to stay at home, and this depends on you, Sonorans. We want you to help us reduce the transmission rate and the number of cases, because these are going to lead to deaths. These are extremely unfortunate. So if you don't reduce mobility, there will be more deaths. Blanca Valadez, please. Thank you. Very good afternoon to you all. I would like to know if you could tell us a little bit about the agreements with the CONAGO. Were some governors upset? It seems that some were. They said the federal government wants to create its own stoplight and is not considering the stoplights that each of those governors are thinking about using. Are they going to be autonomous, or are you, federal authorities, going to be the ones who are managing the stoplight? And now, since Director General Zoe is here, is there any sector of workers that are upset and who are calling for a national strike on July 1st? Why are people so upset? Why are they upset in the health sector especially? And lastly, I'd like to ask you, today, it seems like today was the day with the highest number of cases and the highest number of deaths. Is this the inflection point? Is this the breaking point? Is the curve going to go down, or are we going, if we not reached the mesa yet? Thank you, Blanca, for your questions. I'll start with the third one because it's a subject that we've made comments on and that I want to continue to highlight. There is not one single epidemic. Mexico is a country with 2 billions of kilometers squared, with all kinds of different settlements, metropolises, small and medium cities, and a wide population spread over many areas. It's not just one single epidemic. Don't expect that there's going to be one moment where the whole epidemic starts to go down. We have underscored Mexico City and the conurbated area and the Valley of Mexico because this represents almost 50% of new cases that are presented. Why? Because this is the most populated area in the country. This is almost 25% of our national territory is represented in that area of population. We also have the crest, and we know that it turns into a mesa. And so our plans for reducing incidence rates, well, we're going to start seeing that reflected in hospitalization rates and percentages of people who are in the ICU. We might see that there'll be 5, 7, 15 days where this will start to go downward. And when this happens, we'll have a very important minus going down of decrease of cases. There are going to be a number of epidemics in Sonora, in Guerrero, in Tamaulipas. We've seen some patterns, different distribution patterns over there. Then we have the Valley of Toluca. There are many epidemics. It's not surprising that the cases continue to rise. These are cumulative cases, and they represent a percentage of the cumulative cases. And there, of course, yes, we're going to have more and more every day. So at some point, when the intensity of the transmission rate starts to decrease in Mexico City, most certainly in the next week, then we'll see a reduction in the number of daily cases. But many areas in Mexico continue to have an active epidemic, and we continue to see more and more cases. That's what I'm getting at. Exactly. I don't think that the governors and our two madame governors are upset because I completely trust them, and I completely think that they're loyal. We had an amazing meeting. Thank you so much to the president of CONAGO, Governor Mendoza Cadiz from Baja California Sur, Governor Villa, who is responsible for health in the CONAGO, and the governor of Yucatan. We had a fantastic participation. It was very clear. They were all very enthusiastic. That concern specifically that Governor Pavlovich raised, she also had another governor who spoke to the same issue. Now, in this way, we're saying, please help us to have communication with outreach and communication with our states to say, this is what I'm doing right now, and I want to be very clear. The National Safe Distancing Campaign has not ended, but when it does, we are not returning to an old normal. We are transitioning to a new normal. And this means that an important number of states will still be in a phase of intense high transmission rates. In some states where we have more spread out human settlements, we're going to see a downtick, for example, in Quintana Roo. At the beginning of June, there's still going to be intense levels of transmission, but we'll see next week favorable changes in indicators, which will be able to see that the stoplight will change from red to orange to yellow and eventually to green. Let's be very clear. Please be very clear. At the end of the safe distancing campaign, the epidemic is not over. The epidemic will continue. As we have explained once and again, how we've shown you in the maps, it is not equal all over Mexico. We have some states with lower transmission rates and other ones with higher transmission rates, and it's not synchronous. There's no synchronicity here. We need to get ready for a long pandemic. This first pandemic cycle will be drawn out until June, July, August, and some states definitely, like Jalisco and Nuevo León, according to the projections, the mathematical projections, they could have their epidemic continue, and especially in their capital cities, until October. This is what I want you to be ready for. Okay, yes, about the stoplight. Let's be very clear. I'd like to be very clear again. One single national stoplight. Why? Because if we use different methodologies, then we start to evaluate different things and we start to see different occurrence rates in different areas. There is one single national stoplight, and this is, we've presented this to you, and there's going to be an open and fluid dialogue with states. On Tuesdays, we're going to tell you about what stoplight applies to each state. Each state is going to have a different light color on the stoplight. We're going to have one single stoplight. It's one tool. We're going to see what risk qualification is for each state, and we're going to do this each week for each state. And we're going to have a different color on the stoplight for each state in each week. We're also going to talk to you about this from Tuesday to Thursday so that you can understand and benefit from the information that we have. On Friday, we'll be publicly presenting this, and then it will enter into de rigueur on Mondays. As we've explained, the General Health Act and other laws are very clear when they talk about concurrence. Concurrence means there are two parts at least participating in a process, and our Health Act clearly shows what part is for health authorities and what part corresponds to state authorities. States can also have other regulations or laws to make stricter health laws for managing this epidemic, but we're not going to relax federal measures. Thank you. I just want to tell you that this work, this job that we have to do is that we listen to workers above all. Our responsibility to have PPE for our healthcare professionals, and that must be quality materials. It's not a question of striking. It's not a question of doing that. And besides that, our institutions respect strikes, any strikes that might happen. This is a fundamental element reflected in our government. You are allowed to strike, and that is your constitutional and democratic right. So we need to continue with that respectful stance that we have toward that. And this is not just about where strikes are thinking about coming together and happening. This is all over the place. We're going to have a very long pandemic. And this means that we're going to continue have to requiring PPE all over the country. And at some places, we have seen, for example, in this whole continent, that things are very complicated right now. This is going to be a long haul. And I have said this all the time. We're going to be buying, acquiring, and distributing PPE. And we're going to be showing our healthcare professionals that we support them and we understand that they need this PPE. Legally, I don't have an answer for you. I don't really understand your question. Legally, if there could be a national strike, will there be a national strike because the healthcare professionals don't agree with what's going on? Well, I think we'll need to review the specific case that you're talking about. Healthcare professionals represent almost 1 million people in Mexico at all our institutions, as well as private institutions. And there are different unions. There's the Union of the Social Security Workers. And our union has been working very closely with healthcare professionals to see what they're asking for. Bonuses, recognition, PPE, incorporating COVID teams. Thank you. Thank you. Our time is up, Mr. Carlos. It's 8:01, but tomorrow we will continue with our press conferences. Thank you so much. Soy Revledo, Marcelina. Thank you so much for your important message. Jose Luis Ricardo, thank you for being here. Goodbye. Thank you. Thank you for being here. Goodbye.
See you later.
Thank you. Goodbye.
That was fun.
Yeah, I thought today was really good. I thought you were good.
No.
I thought I was good. Yeah, I thought we were both good.
No.
Yeah.
I